Okay, I think we pulled off a whole bunch of people and went out to talk to the panel, so I'm not sure. Hopefully they're coming back in. I just want to do a couple little introductions, and then we're going to get Troy back up here to talk more programmatically about IMEDS. So in the handouts, we have a couple of pie charts, and we're just trying to give you a sense of, at least at the moment, or since we began really in 2009, where our revenue has come from. And you see the breakdown of foundations, government, and industry, and a few other smaller donations. And then expenses, and as you can see, IMED's our biggest project, and so therefore has the largest amount of expenses. But just as an overview of sort of since the very beginning, if you want to get much more robust financial data, all of our audited financials are up on the website, and you can look year by year, or there's a lot of data, so whatever you're interested in. But I just wanted to bring, this is kind of where we are at this point. We're spending a lot of time right now trying to diversify where we get our funds from. And as we'll talk about in a little while, also talking about a lot of new projects and new areas of interest. So I just wanted to do that quickly. And from at this point forward, we're going to talk about a number of different projects, starting with Troy, as I said, and then Nancy Beck will talk about Predict Tox, another project, and Alicia Chow will talk about a Gates-funded project in tuberculosis that we're part of. And then I'm going to wrap up that section by talking about what are the things we're in the middle of developing. And so you can see, as has been mentioned, food safety is one of the areas, but we have some other areas that we're going to be working in going forward. So let me bring Troy up. You don't know if you want this.
Thank you, Jane. So I'll start out by saying that I've stolen a bit of my thunder through the panel discussion. So we'll go through some of this rather quickly. But I do want to start out and just kind of bring us back to what we were talking about. And during the panel, Sally kind of alluded to the fact that it's the 3 V's associated with big data. And when we talk about or think about drinking from a fire hose, it's hundreds of fire hoses moving in all directions is what it boils down to. And if we are ever going to be in a position to utilize these data, we have to develop the methods that can take into account the velocity at which the data is being provided to us, the volume of data that's coming in, because it is vast and it's growing by leaps and bounds every single day. And really importantly is the variety of that data, because the data as they are coming to us were never intended for the use in which we're trying to use them. So we have to figure out a way through these methods and through other approaches exactly how we're going to be able to use the data to understand the problems that we face. So just a simple explanation for what a method is. It's a procedure that uses data to answer a scientific question in its simplest form. So as we look at IMEDS, these are the 3 components that we talked about. It's IMEDS methods, IMEDS education, and IMEDS evaluation. I'll spend a few more minutes talking about methods and evaluation during this formal presentation. I will say that for IMEDS education, it is the least developed of the 3 pillars of the IMEDS program, but it certainly is by no means the least important. So I will urge you to stay tuned as we look to get this program moving forward. Again, just for methods, IMEDS is really the only program that's focused on methods development in which we are able to bring together all key stakeholders, including FDA, industry, academia, advocates, and so forth. It also provides a very effective and efficient way in which to conduct methods research. As you can imagine, all companies understand that big data, real-world data, is really important to them understanding their own drugs and how they're performing in the marketplace, but also how they can better perform research and development activities to get new drugs approved. So they're all focused on this, but what IMEDS does is provide a central home whereby methods research can be done, so all companies don't have to spend their time and their financial resources to develop these methods and optimize these methods independently of one another. And then we're clearly, through IMEDS methods, looking to address the common goals of focusing on industry-wide problems. And when I say industry-wide, I don't mean just industry as in pharmaceutical companies. I mean healthcare industry in its totality, and finding solutions to satisfy or meet those common goals. So some of the things that we accomplished in 2014 were we developed best practices for identifying adverse health outcomes in these administrative or these big data sets that we have access to. We also, and Bob mentioned this or alluded to this during the panel presentation, we've done a lot of work in understanding the OMOP findings and how those can be applied to the Sentinel network and the work that FDA is doing. And then we have enriched the tools and the capabilities and activities that exist within the research laboratory. We have taken the data sets, the 5 data sets that exist. They were previously in the OMOP Common Data Model. We've also formatted them in the Mini-Sentinel Common Data Model because we understand that there are a diverse group of investigators. Some are more in sync with the OMOP Common Data Model. Others, of course, would prefer to use the Mini-Sentinel Common Data Model. So we found that this has been a big plus for researchers in the laboratory. And we've also developed some additional cutting-edge technologies back in 2014. Now, it's important, and what we have, what we believe is very important for us to do is to disseminate our findings to the broadest possible audience as we can. And so we are looking for ways to expand our communication channels. This slide lists a few. We would urge any of you who have an interest in joining our monthly IMEDS community calls, please do so. Those calls generally involve, they normally last about an hour. They involve a theme that is covered, so we'll invite presenters. And what we are really looking to do is have an active and robust scientific discussion on the topic at hand. That call community is growing, I think, weekly. And we would, again, urge any of you or any of your colleagues to please ask us for information on how you can join that. Now, looking into the future for 2015, what are we trying to do this year and beyond? We, in close collaboration with FDA, we are looking to evaluate the FDA's prompt tool. Some of you may have seen that we have issued an RFP for that work, and we'll be excited to get that work kicked off. We have created an IMEDS challenge, which is really a competition. We're hoping to engage additional scientists in a more competitive manner, friendly competition to accomplish our goals for methods development and refinement. We are looking to establish a center of excellence, which will be an academic institution where we can monitor and report the research activities across different disciplinary boundaries. And then we're also going to be looking to develop new data visualization tools. We understand that this is really important for many of our stakeholders and interested collaborators. And we are going to, of course, continue our work to better understand the best uses and the challenges that exist with big data and observational studies. I'm going to switch gears now and just speak to IMEDS evaluation for a few moments before I turn it over to the next speaker. But as we've said already, IMEDS evaluation is really created to establish really a parallel universe to FDA's Sentinel program. And IMEDS evaluation is the only home for that. It's the only place that any non-FDA stakeholder can go to access these methods, tools, and data sets. And what we're hoping to accomplish is blend the knowledge and experience that we gain with IMEDS methods along with all the extensive experience that has been developed within Sentinel to continue to improve both IMEDS evaluation as well as the Sentinel system. So the way in which we're going about IMEDS evaluation is in some respects very similar to the way that FDA launched Sentinel, and that is in the form of a pilot project. Our goals of the IMEDS evaluation pilot project are twofold. One is to establish the policies and procedures that will govern and dictate exactly how IMEDS evaluation will run once it's in full production mode. For example, at what point do we inform the FDA that a company wishes to ask a question about one of its marketed products? At what point do we involve FDA in that query process? What's the timeline by which a company needs to publicly announce the findings, positive or negative, from the results of a query process? So all that work is ongoing. And then secondly, it's to pressure test those policies and procedures and ask the system 2 specific queries that are important to a company and we believe to the broader universe, and better understand whether those policies and procedures are going to work once we are in full production mode. So I'll just move on to the status of where we are now. So with the pilot project, we have what we have kind of termed wrapped up our final first draft of our policies and procedures. And when I say final first draft, what I mean is collectively we've come together in working with the sponsor of the project, with Harvard Pilgrim, with a number of the data partners, with our collective team to develop policies and procedures that we think will probably work. We don't expect them to work in their fullest extent at this point, but we do believe that they're strong enough to be able to pressure test the system and see if how well we do in phase 2 of the program. We have established contracts with the sponsor. We're in the process of finalizing contracts both with Harvard Pilgrim, which of course is the coordinating center for Sentinel. We felt that it made perfectly good sense to continue using Harvard Pilgrim as our data coordinating center for purposes of saving time and money, and also leveraging the vast knowledge and experience that Harvard Pilgrim has. So we're finalizing the data partner agreements as well. We're also in the midst of finalizing the IRB protocol that will be necessary in order to pose these queries to the system for the 18 data partners. And we are looking to initiate phase 2 of this project, of the pilot project, this quarter. And will ideally conclude the pilot project in the 3rd quarter.